Hey guys, so I'm Gleidson Martins from News Up Now. And during this pandemic, many of us are dealing with depression, fear, panic attack. And how can we come up with this in a good way and how we overcome this fear? So to talk about that, I invited my friend Adam Blum from the Gay Therapy Center in San Francisco. He's the founder and the director. Thank you so much, Adam, for your time. I truly appreciate that.
It's great to be here.
So how can we overcome the fear during this pandemic? I mean, I've been hearing a lot of people, especially on social media, talking about fear, depression, panic attack. How can we overcome that?
Yeah. Well, I want to talk about self-care. A lot of us know how to take care of our bodies. Like we brush our teeth every day, maybe we eat a few vegetables, but a lot of us haven't taught about how to take care of our feelings, our emotions. And the better we get at that, the better we'll feel, less anxiety we'll have. So for most of us, especially right now, we have to learn how to relax the body, right? If we're having panic attacks, that means we're operating at a high level of anxiety. There are many ways to do this. Certainly therapy can help with that. But on a simpler and completely free level, just learning how to breathe. Mm-hmm. The science will show you deep breaths where your belly expands as you exhale makes a real difference in our anxiety level. What if you're able to do that several times a day or even once an hour in a high anxiety part of your life? Lots of deep breathing.
Mm-hmm. So, many people are losing their jobs. So do you think that factor itself, I mean, it's a huge factor, right?
So much is coming at us right now. Some of it have it worse than others. So again, we're going to have to learn how to manage that. So again, it's going to be about how do you take care of yourself? For example, even though things are bad and you're busy and you've got more on your plate, can you budget time to exercise? Research will show that exercise is as good as taking medication for stress and anxiety. So again, exercise, even though I know you've heard this a million times, you should exercise. If you look at it as a mental health component rather than just physical health, but that you need to sweat once a day through your exercise as a way to maintain a certain level of calmness during a very stressful time, like being out of work.
Mm-hmm. Look, I never spoke public about panic attack. I've been suffering for, sometimes with panic attack for years, since 2004, back in Brazil, a long time ago. I saw psychotherapists, I saw psychiatrists, I took medications, and literally, I experienced so many bad situations in my life, like a fear of being on an airplane or being with a bunch of people in the same space. And it's not easy because the first 15, 20 minutes, at least for myself, wasn't never easy at all. I felt like I just need to get away from that situation, from that place. But then you carry that fear with you. So you're talking about breathing, right? And for me, it's one of the exercises that works well. Besides that, I mean, we know this pandemic, this new normal, is bringing, different types of situation to many of us. Besides the breathing, anything else you can tell us and tell our viewers that can help us in those like 15, 20 minutes of the panic attack?
Right. Well, one thing that helps, when we name what we're feeling, we start to feel some control over it and we get some distance from it. So just saying I'm stressed, well, that's not really naming a feeling. If you can learn more about your feelings and put some words to it. So for example, someone who suffers from panic attacks, if you can say, oh, I'm having a panic attack right now. That gives it gives you a moment to get some distance from it. In that second, you're not in it. You're thinking about it. And that might give you just a little more calm to then be able to take the next step. Oh, I'm having a panic attack. Well, what do I know about panic attacks? And then you can think of some calm things like, well, I know that I get through them. I know that I don't get stuck in this place.
So do you think having knowledge will help?
Absolutely. Knowing how your body reacts both to panic attacks and other things is a key part of growing our mental health.
Mm-hmm,
So
mm-hmm.
I want to say one piece about that, and I appreciate you disclosing your own issues around anxiety and panic. People who kind of come into this crisis time already with a predisposition to anxiety, depression, addiction, it's harder. It's just literally going to be harder. It means it's going to take more work, more self-care for you to get through it. That's just true. And I like to think about it, if you're suffering from one of those conditions, you were also on the front lines, not just the hospital workers, but people who are struggling with a predisposition because they were born with anxiety or they had trauma in their life, and so they're more anxious. You've got more to manage. You're on the front lines of this. And I think it's important to feel a lot of self-compassion about that for yourself. Oh yeah, this is why it's going to be hard for me right now. I understand that. I can't expect to be my best self right now during a global pandemic.
I don't want to make this interview about myself, but just one more thing I wanted to say about panic attack, and then I'll move on my side. When you have panic attack, many of people, and I'm going to include some health workers, they don't take you seriously. And that makes you feel more anxious and make you think like, okay, am I crazy here? What I'm feeling, is it real? It's not real. What is panic attack?
Yeah, well, that's where compassion comes in, right? Compassion for yourself, right? You're feeling judged. When you're having a panic attack, you're feeling other people are judging you. So, I would coach you to work on self-compassion. You know a lot about panic attacks because you've had them. In fact, you're kind of an expert. You've been managing that for several years. So you know more about that than many people around you. So developing a sense of self-compassion, self-understanding about that, seeking out people who are compassionate, right? If you have a healthcare provider or a therapist who isn't getting it, who minimizes it, who says that's nothing, they're not a good healthcare provider. Let's just be clear about that. Good mental health care is with people who have deep compassion and will get you and won't try to fight with you about what you're feeling, but will accept what you're feeling.
Interesting. So not all of the psychotherapists will be able to help somebody with depression or panic attacks. So is that how is supposed to be the treatment with a professional like yourself?
Yeah. Well, matching is very important in all kinds of healthcare, but especially in psychotherapy. You have to feel really connected to your therapist for the therapy to go well. And there's a ton of research about that. All of our therapists, we have our own specialties, these theories we love, but we're humbled when we read the research. And the research says the number one reason a person will do really well in therapy is that they feel really safe and really connected to the therapist. That relationship is a key part of actually feeling better and getting better. There's something wonderful when you trust somebody, you're honest with them, you're able to say things and know you're going to be received with love and compassion. That's healing. So that's probably the most important thing. Make sure your healthcare provider is someone that you just have good chemistry with. And if you don't feel like you have that, then it's time to find someone who you just feel like they get you and that they feel good to be around.
So during this pandemic, I believe depression increases tremendously around a lot of people, right? Especially those who are losing their jobs or freelancers or artists that depending on some events to be able to support themselves financially and also emotionally. So how can we deal with depression?
Yeah. Well, first I want to say is we do have to accept that we're going to have more depression during this time, especially if you have a predisposition to it. You're going to feel more depressed. So I think there's some comfort in just accepting what's true. You're going to try some things to move out of the depression, and some will help and some won't. But to expect that you're going to be at your full capacity during this time is not realistic.
But what is depression? I mean, sorry to cut you off, but just before we move on, if I'm feeling a little bit sad today and tomorrow, I'm staying home, let's say, making this case here, So it does not mean I have depression, right? When is the level, what is the level of someone's getting to the point of, okay, I'm having depression?
Right. So depression is a clinical term, and to get diagnosed with depression, you're going to have certain kinds of physical experiences, like having trouble sleeping, significant trouble sleeping, not being able to get out of bed, finding no joy during the day, maybe loss of appetite. So a lot of physical changes, not just for a day, not just for 3 days, but for a period of several weeks. And that's when you start to realize, okay, I'm not just feeling depressed, I may actually have a depression. And that's when you definitely want to get some help and treatment. Psychotherapy, possibly medication. You'll have that conversation with your therapist to see if it's appropriate for you. At the same time, you want to be adding what we've been talking about, self-care, right? So exercise is a treatment for depression if you can get out and do that. Talking to people who support you, whether they be professionals or friends, trying to just share, joining online groups or people who are feeling the exact same things you're feeling. Mm-hmm. That feels good. Oh, I'm not alone. I'm not the only person who's feeling really depressed. That's very healing. Doing some of these apps, there's so many great apps now, and most of them are free, that will help you think about your thoughts, do some cognitive behavioral therapy with your thoughts so you can change your thoughts, especially the negative thoughts that cause depression. Headspace, Calm, Insight Timer, 10% Happier. There are many. These have all been tested by psychiatrists and hospitals, and they work.
So you are the founder and the director of the Gay Therapy Center in San Francisco Bay Area, and also you have offices in Los Angeles, New York.
Yes.
So are you feeling there's an increase of in the number of patients because of the COVID-19?
We're not seeing an increase in psychotherapy right now. And I think that is common. What happens during crisis in the beginning stages, people feel a little frozen, right? I'm feeling the stress, I'm feeling a little frozen. And it isn't until a little bit later that they're willing to take that step, which for many people is a big step, which is to ask for help, right? And to see a therapist. So we often, when there's a crisis, there's a delay, a month or two before things get really busy in terms of mental health care. I'd encourage people to call before you're in crisis, but to find some help if you are under distress.
If someone is watching us right now and there's some symptoms there that person is feeling, so is that like a number of symptoms, or what kind of symptoms and sensations that person is feeling at that moment that you recommend, okay, now it's time, if you're feeling this and that, you need to find help?
Well, if your activities of daily living are being impacted by this, meaning you can't sleep, you're sleeping very poorly, or you're not eating much, or you're actually just feeling depressed day after day after day, or you're unable to concentrate pretty much at all, those are high alarm signals, right? I would encourage you strongly to seek psychotherapy. And again, you can get psychotherapy very inexpensively in major cities. It's very available. You can pay a lot or you can pay a little. If you don't have a lot of money, just type in sliding scale psychotherapy in the name of your city, or low fee psychotherapy. A lot of clinics are available. All the work is done online these days, pretty much, and it's very effective. And research shows doing this work online is equally as effective as doing it face to face.
What about cognitive therapy?
Yeah. Well, that is the number one treatment for anxiety. So it's called cognitive behavioral therapy. CBT is the name for short. So if you're looking for a therapist and you're especially suffering from panic attacks or anxiety, CBT is one of the best researched forms of psychotherapy for anxiety. And it's a process of examining your thoughts, catching your thoughts, naming your thoughts. Once you're aware of them, then you have a fighting chance to actually shift them. So you get into that practice of then shifting your thoughts to something that's more positive, but also true. When our thoughts are often creating negative feelings in ourselves, and most of those thoughts are not true or not fully true. The mind thinks that negative things is happening 100% of the time. But the truth is that negative thing maybe only has a 1% chance of happening when you're predicting the future. So getting good at naming that and catching yourself and then coming back to what's really true, that's positive.
So do you think the unknown situation can aggravate, can bring more anxiety, depression to people? Because we start like the shelter in place. Oh, it's going to be for a couple of weeks, and then it's going to be a month. Now another month. So the unknown can elevate that depression, that sensation of I'm not feeling good mentally.
Yes, you really named it there, Gleidson. Yes. We're all suffering from that. Every single human being on the planet is suffering from that feeling of unknown. So you're going to feel more anxious. You might feel more depressed. There's no way around that. You're a human being trying to deal with something that no one has all the answers to. So what are you going to do with that? Well, your choice then would be to try to reduce that feeling of anxiety that comes from unknown. And we've been talking today about some of the techniques. There's many others, but those are some of the core techniques of how do we take care of ourselves emotionally so we feel less anxious. But getting rid of anxiety, having no feelings of depression during this period in human history, that's not realistic.
What did you tell those heroes, those frontliners, the professional health professionals that are dealing with the virus, as a frontliners there that are anxious to get away, but at the same time, they need to help. That's what they went to school for. That's what they're passionate about. What would you tell them to manage that anxiety, that level?
Yeah. Well, they are in a tough situation. So the good news is that they're not alone, and they know that, right? Because they see it around them. They are probably supported from their colleagues. I would encourage them to be able to find colleagues that they trust and to share the stories with them, because no one knows what you're going through more than that person right next to you at the job. So is there one person at the job you can be really honest with and share some of the stuff that's a little harder to share about your own suffering and your own anxiety? So again, support with others really is quite healing.
Yeah, I have another question here. This is from Robert in San Rafael, Marin County. I've been doing therapy for 3 years, and I feel it's not working for me. What should I do?
Well, 3 years means you've invested some good time in the process. So if you're not feeling like there's been some growth and some change in 3 years, it probably is a good idea to do something else, right? So it could be that you and the therapist aren't doing the best possible work, and you might want to try a different kind of therapy or a different therapist. I want to encourage you to actually discuss that with your therapist. Every single therapist is trained to answer that question non-defensively. If you say to your therapist, I'm having some concerns, I'm not feeling better, and I'm wondering, are we a good fit, or, do I need a different kind of method? If they react defensively, that's not good. That's against their training. So that would be a signal like, oh, maybe this therapist isn't the greatest therapist. But hopefully they would respond with curiosity and interest and help you figure out what's right for you and what isn't working in the therapy.
Interesting. So I guess we need to know how far can we go with that conversation with the therapist.
Pure and total honesty, as much transparency as you can possibly muster. Therapy is not really very effective if you can't be really honest with your therapist. And that includes honesty, how you're feeling about them in the moment. So sometimes people are shy to do that, but I would encourage you to be very honest, very blunt, very open about all aspects of your life, including your own experience of them as therapists.
So just to wrap up, if you can give some short answer for this. During this pandemic, I guess in the news we do not talk about suicide very much. The reason is we don't want to make a knowledge of that because you don't want to promote that sort of thing. But if it's someone, are you noticing any increase on that topic?
I haven't seen that, people being more suicidal, but we would expect some of that. I think whenever there's some stress, that might happen. I would encourage you to talk about it. We as therapists, we don't shy away from that. We ask someone, are you thinking about killing yourself? And it's okay to ask that of your friend. If you're worried about your friend, you think they may be very, very depressed or getting some warning signs, it is okay to say, are you thinking about killing yourself? Just a question, and it's a very important question.
Absolutely.
And if they say yes, the next question would be, do you have a plan? And if they say yes, I have a gun at home, that's a huge alarm system, right? So that's when you need to call for help. You can call the police, they're trained to deal with that, or a mental health crisis team that all cities have, or certainly a therapist, or bring in more people.
Okay, and speaking of a number, the National Prevention Suicide Hotline is 1-800-273-8255. 1-800-273-8255. Adam Blum, thank you so much for your time. I really appreciate your words. They're very thoughtful. Thank you.
You're welcome. You take care.
You too. Thanks. Bye.
Bye.
And thank you so much for watching. I'll see you next time.